I'm Izzy Greenberg. Today we are joined by our resident panel of experts, Ava Bermudez-Zimmerman from the Child Care for Connecticut's Future campaign, and Merrill Gay from the Connecticut Early Childhood Alliance. We also have a packed morning with multiple topics to go over, including some announcements and updates from the Office of Early Childhood, some information about a provider survey, some polls for you all. So we've got a full morning. We will get started in just 1 second, but I want to remind everyone to use the chat for technical difficulties and for communication between the community if you want to talk to each other. But if you have questions for our panelists, please use the Q&A and please wait until you're kind of on the topic. And in fact, on days like today, when there's multiple topics, it really does help to say, you know, this is about the survey or survey : whatever, or OEC : it just really helps me to keep it straight. Sometimes I'm trying to read all of these things and keep this thing moving. So that would help me today. Okay, I think we are all set to get started on provider survey. Merrill, you ready to go?
Sure. So I wanted to take a few minutes and talk about the annual survey that the Alliance does of providers. We have done this for the past several years, and it's provided really invaluable information when we're advocating at the Capitol. Last year, our survey consisted of roughly of programs representing a quarter of the licensed capacity in the state. And from that, we were able to extrapolate that the industry was short about 5,000 staff or 4,000 staff. That was a very powerful piece of information to use while advocating at the Capitol. So I'm going to stick a link into the chat, and I ask that you do this survey, and let me tell you what will be in it. It's going to include information. Well, first of all, it is an anonymous survey. So it does ask your zip code, but that is simply so that I can determine if I've got more than one response from a program. But I want to make everyone confident that there will be no individually identifiable information about your program released to the public. It all gets combined. Yeah.
Let me interrupt. It seems like maybe some folks aren't hearing you. Are you in the English or Spanish?
That is a good question. Do I have
Make sure you are. And folks, join the English or Spanish feed from the little globe, interpretation globe, and then that should be fixed.
Okay. So hopefully it's working now. I've just put into the chat a link to our annual survey. That survey will take about 10 or 15 minutes to do. So please check and see if there's somebody else in the program who's on this call who might be filling out a duplicate version, and save yourself some time. The survey asks questions about enrollment, about staffing, about morale, about facilities needs, and for the first time, questions about liability insurance. This survey is what we use to be able to have local information to talk to legislators about the needs of the industry. It is an anonymous survey, so I'm not asking your program name. The closest I get is by zip code so that I can be able to share information with legislators about what's going on in their part of the state. But I will not release any information about your program. What we are trying to do is get as many respondents as possible to make sure that we've got as clear a picture of what's going on in the industry right now. So it'll ask you about your enrollment. It'll ask you about open staff positions. It'll ask about is your program breaking even? It asks about staff morale, your morale. and facility needs and insurance. So this is a way that we can gather information anonymously to be able to share with policymakers to advocate for change. And I do want, okay, so I'm seeing a message here. Do you want me to fill one out for each center I operate? Each one is in a different zip code. I think if you've got the information you could do for all of them together, that's fine. But if it's easier for you to keep track of, I've got 3 different centers or 5 different centers, and it's easier for me to look at the information for one and just do that. Do it. You could do it either way, but I'm trying to get information about as many different programs as possible. I think it probably would be best if you did it individually as I think about it for each one, so that I've got information from different parts of the state. And I just want to say again, the information provided by the surveys we've done in the past has been hugely helpful in advocacy. It's a way to bring headlines home to legislators. So I will post this again because I'm seeing somebody saying I didn't, it got posted before they were on the call. So let me just post it again.
I can do it, Merrill.
I got it here. And if there are any questions about it, I'd be happy to answer, but it's been a very, very helpful thing, and I hope that everybody can fill it out.
What is the deadline to submit it?
Deadline, we're trying to get these all done by the end of October. So, but
somebody is saying, what is the survey for? But you went over that, maybe just two sentences.
So it's to gather information from Connecticut about what's going on in the childcare industry so that we have an accurate picture when we talk to legislators and elected officials about the state of the industry right now.
All right, anything else about that?
I was wondering, do you expect it to be only center directors and owner operators doing this, or is this also staff? Like who should be filling this out?
This should be center directors and owner operators who do this.
And is this survey only home-based, center-based? Like who is the demographic you're trying to reach?
It's family child care and centers.
And if you can't speak, if you're center or home-based provider, owner operator is a monolingual person, what are the options?
It is translated into Spanish.
Can you please define school age?
School age would be children who are in school and are getting care afterwards. So kindergarten on up. And
are you going to send this out to everyone via email as well?
I will be doing that as well. Yes. So if you do the survey now and then you get an email about it, you can ignore the email. But we are trying to get as many programs as possible to complete the survey.
Someone just pointing out that the Connecticut Project just completed a data report from parents of kids birth to 5 in Connecticut on childcare. Does this, is that something anybody has that we could share out, or does that in some way relate to what? No, because it's for parents.
So that's about parents. That's parents' experience. This is about providers' experience.
Yeah, thank you. And if someone has that, we can share it out. If it's, I don't know if it's something that's
we could probably ask the Connecticut Project to come on and present their
yeah. It's not ready yet though. It's not in they had a presentation about the findings and they haven't posted it on the website. It's a rapid survey, but as soon as that's official, I agree with Merrill. We should ask them to come on.
Sounds good. Yeah. All right. Well, stay tuned for that, folks. Okay. Ava, did you have more questions?
No, I think you got it.
Okay. I think that's it for survey. Let's get, we have a poll that we wanted to do today. I know we haven't done a poll in a while, but you guys should see this pop up on your screen. whether you're on a computer, an iPad, a phone, it should be easy for everyone. The more people who can do it, please do. It's a very simple survey. We just want to know who's here. And this is only two questions. Over time, as you guys remember, we started these March of 2020, and the population of folks who have joined these calls over now 4.5 years has changed a lot. And we want to make sure, you know, in the same way that we're always asking you for topic ideas that you want, it's also important for us to understand who's here, because that also helps us in terms of thinking about our guests, the information that we're sharing out. So if everyone could take a minute to do that, we're up to about 50% participation. Would love to get at least to 70 if we could. Okay, someone is saying the one-page synopsis for the CT project survey is in the works. So hopefully that will be able to be shared out soon. We'll just give this 1 minute. And Ava or Merrill, while we're waiting on that poll, do you guys have any other announcements or updates that you'd like to talk about? Just this would be a good time to do it. Maybe the Advocacy Academy, Merrill, do you want to give a quick?
Yeah.
I'll go after Merrill too.
Okay. So we have an Advocacy Academy that is aimed at people who've never done advocacy before. It's an intro course on advocacy. It consists of 2 hour-and-a-half webinars, and then the third session is an afternoon up at the state capitol, seeing where things happen, learning the rules of what you can and can't do up there, and meeting with legislators to talk about the importance of building relationships with legislators and understanding things from their perspective, so that you can better structure your advocacy. Vanessa has just stuck a link into the Advocacy Academy, into the chat about the Advocacy Academy. For Alliance members, you get a number of free slots, spaces at the Advocacy Academy, depending on the size of your organization. There is a $100 charge for people who are not members of the Alliance. I will point out that if you are thinking about becoming an Alliance member and thinking about going to the Advocacy Academy, it's cheaper to become a member of the Alliance than to send 2 people to the Academy. And you get 2 free slots with your Alliance membership if you're a single site program. We will be also following up after the election with a policy briefing for legislators and advocates, and are working on an Advocacy 201 with the coalition. So if you become a member, all of those, you get scholarship slots for all of those trainings. And I think we're up to 45 or 50 people so far signed up. This should be interesting and a great way to get your toe in the water as far as advocacy, because we've got lots of work to do getting our legislators to understand what's really going on in early childhood.
Great, thanks, Merrill. Ava?
So we have some designated dates for Childcare for Connecticut's Future for events. And the biggest date that we have that's confirmed is a film screening followed by a panel on childcare. It's going to be at the new Friends Center location that also used to be a movie theater. So we are fortunate enough to be the first to be screening on the movie theater screen there. That's at 25 Flint Street. The date for that event is November 16th. November 16th is a Saturday. The event starts at 3 p.m. and ends at 6:30, but it's a 2-part event. So the film screening portion is going to start at 3:30. So doors open at 3, dinner, late lunch dinner will be served. We're going to have a food truck out there in front of the venue. And then after the film screening is done, by the way, the film screening is going to be Clarissa's Battle. It's a documentary of a parent advocate really challenged by childcare, getting very engaged in her community and trying to change legislation locally and federally, because as you guys know, childcare providers are underpaid and providers are swamped and parents just can't afford it. So the film just carries through the day in the life of this activist and this conversation. And then the film, when it completes, we're going to take a quick break to once more give people an opportunity to eat. And if people are just there for the panel conversation, to settle in. And then we're starting the panel conversation at about 5 p.m. And we're going to have about an hour 15-minute panel. The panelists will be Representative Corey Paris from Stamford. We're going to have Senator Stephen Harding. He represents a multitude of towns, about 12 of them, spanning from Brookfield all the way to Torrington. And he's also the minority leader. We're also going to have there Clarissa herself in person, in part of the panel discussion, as well as a child care provider representing. And it's going to be moderated by journalist Mike Surelli. So November 16th, save the date on your calendar. Film screening at 3, panel discussion at 5. Food will be provided. We really hope that all of you could spread the word, and we're going to try to fill the room with some legislators as well. And then the next big date that we have is November 20th. I know a lot of you on the call are very eager to hear what the impact will be of the presidential election on childcare. You know, if so-and-so wins, what will that do to our economy? What will that do to childcare legislation on the federal side and also on the local side? So we're going to have some awesome lobbyists jump onto the call, give us some step-by-step in conversation on, you know, what are we to expect depending on the election results locally and nationally. And then followed that, we're going to have a conversation of why it's important to get more engaged and share your story, kind of like prepping us and getting us ready for the legislative session. We do expect to have some legislative trainings a little bit more in depth closer to January. But of course, I plug in for the Early Childhood Alliance's training, which is a lot more engage with folks, because in person and other layers of that training. So hopefully you can save the date, November 16th, November 20th. November 20th, by the way, is going to be at 6:30 p.m. and it is on Zoom. And then again, November 16th is in person, New Haven, 25 Flint Street, 3 and 5 p.m. There's other smaller events that Childcare for Connecticut's Future is hosting, like local meet and greets, but we're going to try to make it a point to put it all in one calendar. And that way you can select the locations nearest you. And I'll pass it back to you, Izzy.
All right. I can see listen, everyone, I can see somebody saying one thing says November 14th. I am going to fix that right now. But there was 2 dates. It was November 14th and 16th. I thought that we had changed that date everywhere, but you guys are close readers, which I love. I will make sure that gets fixed right away. But it is November 16th, which someone is also saying is the same day as the All Our Kin Educator Conference. And so hopefully there are some folks, I know we will have codes to watch the movie in advance. And so if everyone after this day feels like doing a little bit more listening, you could watch the movie in advance and show up for the panel discussion only at 5 p.m. So that's another option. It's not a great one if you've been in something all day long, but hopefully we can make that work. All right. Thank you so much, Ava. We are at 71%. So I'm going to end the poll now and just share these results out. And so most of you should be able to see this, but we have 67% licensed providers, 16% nonprofit staff for director. Let's see, 3% advocates, 12% other, 1% unlicensed provider. And then what type of childcare provider are you? 43% center director. I'm sorry, I realize this is probably too fast for interpretation. My apologies, Sandra. 43% center director. Next is 29% family childcare owner, and then 6% center staff, with another 1% of group family childcare, and then some other folks who are not in a childcare center at all. So thank you all so much. It's really helpful for us to have the details of this. Okay, Next up, we are going to turn to the Office of Early Childhood. They had some announcements and updates and asked to come on this morning. So we've got Elena Trueworthy here to kick us off. Elena, I'll pass it to you.
Hey, thank you so much. And good morning, everyone. Sorry, my lighting seems to be off this morning, but always appreciate Early Care Connections and being flexible to have us on. There were several important announcements and exciting announcements last week, and so we wanted to come on and be able to provide that to the field in a very timely way, and then also to provide a progress update when it comes to some of the licensing and ratio changes in the work going on there. So last week, the Governor Lamont, and Commissioner Bai made some exciting announcements about Care for Kids. And so want to thank the CCDF team at the OEC for all their tremendous work when it comes to really understanding and looking at the field and meeting the requirements of the federal government as well as we move forward here. So there were 3 exciting announcements about Care for Kids, and then also one about state-funded child daycare and school readiness spaces that I'll get to. So the first one is that Care for Kids, we will be capping family fees to 7% of a family's current income. So right now, Care for Kids is capped at 10% for families based upon their income. So this move really looks to help families, right? To help them save some funding when it comes to, being able to afford quality childcare for their children. So capping at 7% will actually save on average about $200 per family. And this is a huge change when we think about how challenging it is for families to afford childcare. This really moves us in the right direction. Very important to note is that the OEC will cover the difference, right? So there will be no negative financial impact to programs. Programs will not feel the difference. This is a savings for families, and programs will be held stable in that way. The second announcement is around, cliff effects for families. So we will be increasing to 85% when families can continue to stay on Care for Kids. So moving to 85% of the state median income. So this move really helps families when they get a raise, right? Maybe they get a new job and they increase their income, that they don't get removed from Care for Kids until they reach the 85% of the state median income. So right now we're at 65% and we're moving that to 85%. All right. And the third announcement is that Care for Kids will be serving 1,500 more families. So right now we serve around 21,000 families. Our target is 21,500 children. And we will be able to serve 23,000 children in the near future on Care for Kids. So again, opening up that availability for families to access affordable childcare for their children. And coupled with those exciting Care for Kids announcements, the OEC is also going to be opening up 900 new child daycare and school readiness spaces across the state. So the early care and education team is hard at work planning for those, and we'll have more announcements and more information to come. But that is the plan, to be able to increase our state funded spaces for CDC and school readiness by 900 spaces. Okay. So those were the exciting Care for Kids and state funded space announcements. and I'm going to move on to.
Lena, we've got a couple questions. Do you mind?
Sure.
I just jump in. Brittany wonders if this means we will get new certificates for current families to account for the increase.
So I think as we, move forward with processes, all of that will be communicated and become clear for providers. So we'll make sure the communication is clear as these changes take place.
Okay, and someone else is wondering if these are infant toddler spaces as well.
Yes, for the state funded, it is available also for infants and toddlers. Maggie, I see your hand up. Please add.
Elena, I just wanted to make sure, did you mention the effective start dates? I might have missed it. I just want to make sure everyone's aware that the family fee starts January 1st and the cliff effect, 85%, starts October 1st. So just be aware that there is a time.
Thanks, Maggie. And I can see that Julie has also put in the chat, the new certificates will be issued with changes to family fees. Merrill?
I had a question about, this is all the money that was appropriated in the last legislative session, and it's essentially now making it real. I mean, activating it as opposed to any new money, correct?
So there are different ways in which we've been able to look about and think about the funding, right, for Care for Kids in particular. But you're absolutely right. It's the American Rescue Plan dollars does play a big role in the Office of Early Childhood being able to do that and being able to make these changes. We do anticipate that we have budgeted for the next 3 years to be able to keep these changes consistent.
And the 900 new slots, is that unused money being reallocated?
Yes. And so we have the past year, but also previous years, lapsed funding as an agency when it comes to our early care and education line. And so this is really ensuring that we're maximizing all of the current dollars that we have within the state budget in order to meet the full need of children and families, as we move forward. So, and I see Commissioner Bai has joined, but I'll just add this one additional point is that these changes really move forward and are in line with our Blue Ribbon Plan recommendations and goals. So with these expansions, we're actually about a year ahead in what we were, considering for our Blue Ribbon goals and timeline, which is really exciting. Welcome, Commissioner Bai.
Hi, everybody. How are you? You were doing great.
So just so you know, I just covered the Care for Kids expansion announcement and the state-funded spaces as well. And we have yet to cover the licensing ratio piece.
There's still a few more questions, but Commissioner, I'll let you jump in before that.
No, we're happy. We're here to answer your questions, so we're happy to do that.
All right, so there's a couple more. Let's see. Is the addition of there's two questions that have to do with the 900 spaces. One is it tied to the early start RFP process? And the other is how are these spaces being divided among the school readiness towns?
So it's a great question. And I know I'm pushing our team to get these seats out, even though it could be confusing with Early Start Connecticut. I don't want logical sequential to get in the way of children and families being served. These are spaces available this year before any early start RFA. These are spaces for now, as soon as we can get them out. And we're hoping that's soon, very soon, because we know families need the care. So it's separate, and they will be divided in much the way other ones are. It'll be prioritize high need communities, deserts, infant toddler care, but there's also room for preschool applications. We do find there's most of the requests now are for infant toddler care, but it will follow a similar process to the infant and toddler RFA, which will just be scored based on high need community, high desert score, accreditation, to get the highest quality settings, that kind of thing. Elaine, I don't know if I missed anything.
Yeah, I just want to make sure. So our plan is to ensure that these spaces, right, continue right into the years coming up. And so it will get kind of folded in or embedded into our full allocation of spaces across the state.
Do you have a sense yet of like when you would expect to be taking applications for those the 900 slots?
I mean, hopefully within the next 6 weeks, we'll be there.
Okay, great.
Just got to get them out. And I've been saying this since, the summer, because this is what happens when you have better data systems and we have a better understanding of the spaces, that we don't need to be like so protective, and year after year we lapse funds, and that means kids aren't served. And these kids will be, part of the count as we move to early start as well. So they're going to stay. We calculated it as if they were in all year, so that next year the dollars can continue, even though they won't be paid for the full year.
Okay.
I'm seeing some folks not hearing. I just want to remind everyone that if you choose and click interpretation in your menu, you'll have to choose English or Spanish to hear everything. So just a reminder for folks to do that. How long, I don't think this was the question you asked, Merrill, but how long will this take to implement?
Well, the idea is to just get the spaces out to the programs as quickly as we can, and then they can get them out. Once they know the funding's coming, they can get them out. So as soon as we can get them out.
Will Care for Kids be available to all families despite legal status? Is this open to families without documentation?
Care for Kids is not open to families without documentation. These state-funded spaces are. So the state-funded spaces are sort of basically, they're going to merge into Early Start Connecticut spaces. So I don't even want to call them school readiness or CDC, because they're just going in now. Those are open to anyone. The spaces, the Care for Kids, the additional 1,500 in Care for Kids, they may not be undocumented immigrants. They have to be citizens.
Thank you. Are the new income regulations going to be applied for new applications? And if so, will there be a new waiting list?
They are applied starting in January, because we have to make a lot of data system changes. So 7% will be starting in January. We don't anticipate this will add to the waiting list. We have the dollar set aside from the American Rescue Plan and from our federal carry forward. So, to the extent that there's a waiting list, there is a small waiting list right now. So that just exists, but this doesn't add to that.
Will a new program be able to apply for spaces, or will this be only an expansion of space for currently funded?
These are only for currently funded providers, because we need to get the dollars out quickly. But new providers are free to apply for Early Start Connecticut expansion.
If families were denied because of income or family fee, are those cases eligible to be reopened?
For Care for Kids?
People don't always specify.
Well, as soon as we made the change to 85%, we had United Way hold on redeterminations. So any new redetermination should take into account this 85%.
Yes, and it looks like, yes, it's Care for Kids.
Yeah, so those should be set. And the new family fee will start in January.
Great. And where does family childcare fit in with these 900 slots?
There are currently family childcare providers, I think maybe 170, Elena, around there, family childcare providers, 170 children.
Spaces, right, exactly.
So it's probably more like 70 or 80 family childcare providers currently have state-funded spaces. And one of the challenges they were having is their infant and toddler slots would be turn 3, and then they were concerned that the family then suddenly had to pay full fee. So this will allow them to apply for additional spots to account for that. So children in their program could continue with state funding through preschool. So they may apply, nothing's guaranteed, but they can say, yes, we can take more state funded spaces. and they may be awarded them.
Are you considering, is there a geographic priority in how these slots are doled out?
The geographic priority will be childcare desert. So, you know, basically every census tract has a sort of desert score that we use to say what's a shortage in this area. And so that will be part of an equation. It's not the only part.
Right. There's a comment I'd be remiss not to say, which is new spaces are great. Now we need some staff.
Exactly. I talked to many directors who wanted to apply, but didn't think they could get the staff. So yeah. It is the problem.
Right. There's still a couple of questions here, but I want to give you guys time to get into licensing. So if there are OEC staff on here who can go into the Q&A and type answers into some of these, that would be helpful while Elena and Liz are continuing on with licensing announcements. All right, go ahead, Elena.
Hey, thank you. I'll hand it over to Commissioner Ba. You want to tackle the licensing?
Sure. And then we have Liz here. I know in terms of timing and things like that. Liz Proietti is our division director for licensing. So there were two significant changes in licensing regs related to ratio, which is what we were asked to come here and talk about, because there are some other pieces of it that I think providers will be interested in as well. But in terms of the ratio, school age ratio is moving from 1 to 10 to 1 to 15. And infant toddler ratio stays at 4 to 1 until the child turns 2, at which point it can go to 1 to 5 until 2 years and 9 months, when they sort of become preschoolers, and then it goes to 1 to 10. So for that 9-month window now, there can be a ratio of 5 to 1. Those are the ratio changes. Liz, do you want to add anything?
Thank you very much. I just wanted to make sure that everyone is aware that the Legislative Regulation Review Committee did meet last Tuesday to approve the regulation. It is not yet effective until we submit some technical changes to the Secretary of the State, and then the Secretary of the State, probably a week thereafter, there'll be an effective date. So we have until October 8th to submit those technical changes. Once the regulation is effective, while the change in ratio for 2-year-olds will go from 1 to 4 to 1 to 5, we just want to make sure that people know that it's not an automatic change for everyone. There has to be available space in each classroom in order for this to happen. Some of you may remember your
I think we've got a quick pause on Liz. While we're waiting on
Commissioner Bai, there was a question in the chat. Could you repeat the ratios changes? I think at least one person missed it. So I want to make sure everyone understands the ratio changes. Very important.
A ratio for school age is now 1 to 15. The ratio for infant toddlers is 1 to 4 until the child turns 2. And once a child is 2, it goes to 1 to 5 until they become eligible for preschool, which happens at 2 years and 9 months, when it goes to 1 to 10.
I'm sorry. Okay, I'm putting this in. 1 to 5 is for 1 to 5 is till the 2 years, 9 months, right?
Yes.
Excuse me. When a kid turns 2, up to, say that again.
2 years and 9 months, up until 2 years and 9 months.
Get it. 2 through 3 years, 9 months. And that's 1 to 5 now?
Yes.
Okay, and then from that up, it's 1 to 10.
Mm-hmm.
But it is 1 to
15.
1 to 15.
Yeah.
No, it's 1 to 10. That's school age.
Yeah, preschool is 1 to 10, school age 1 to 15. Sorry.
Sorry,
Yes.
sorry to, yeah, just wanted to clarify.
Yes.
Preschool is that's preschool and just say
This is only centers. Family childcare has their own ratios. So.
Right.
Just let me add in, and Liz, maybe you can correct me if you can, is 2.9 years of age. I do believe you need written agreement permission from both the parent and the program. It's really determining whether the child is ready for preschool or not. So there's some, it's just not automatic. It's a voluntary change.
Great, thank you. Okay, Liz, you're back.
Yeah. I'm so sorry about that. I'm having some technical difficulties. I'll try to be quick in case so this doesn't happen again. I think what we will be sending out guidance about is that in order to make these changes from 1 to 4 to 1 to 5 programs, if they think they have the space, we'll need to submit a change form to the OEC. A specialist may need to come out to measure to make sure that there's enough room in each classroom to go to these increased ratio and group size requirements, and local approvals from local health and the fire marshal will need to be included with that. So it's we know that programs are the ones that want to go are excited about this change, and we certainly will do our best to get to everyone. But just to give you a heads up that we will need information about the programs that want to do it, and we'll need to make a visit to the programs in most cases.
Thank you.
Thank you, Liz.
Reminder for folks to click interpretation and choose either English or Spanish. Merrill, you're up.
So I'm seeing a bunch of questions about when does this all come into effect? And what Liz said is that they've got to submit some technical changes to the Secretary of State. And then once that's all in, there'll be another week or so before that takes place. So it's not going to happen probably before the end of October, but maybe, and we'll let you know when it's actually becomes real.
Okay. We've got a lot of questions here. I was hoping someone from, I don't think I typed that all out right when I was trying to get it. If someone here could type out what those ratio changes are and please put them in the chat, that would be helpful. Someone's wondering if you have a mixed age classroom.
Yeah.
Does the ratio follow the youngest group still, which is 1 to 4?
Always follows the youngest in the room. So if you have like I always worked in a toddler room from 14 months to 3 years, that would stay at 4 to 1.
Okay. Merrill, I'm trying to deal with interpretation. Is it possible for you to ask questions for a minute?
Sure. Okay, let me see which ones we still
cleared out most of what is
yep.
has been answered.
So let me try and focus on, so the questions about the 900 new slots. There are some questions about whether family child care providers will be able to apply. Will there be any other new intermediaries for them to work with? Will you still require intermediaries?
The existing family child care programs who are in the state funded system may apply. Just like centers, the existing centers can apply, but not new centers. That's coming in the RFA.
Okay.
That'll come out. I don't know when that's due out, Elena, but in the next month it'll be out.
Okay, so for these 900 slots, they're essentially being redistributed or distributed to existing school readiness and CDC programs, including the family child care providers who currently have some. For new people who want to come in later on, it will be later. It'll be when you switch over to early start in July of next year.
Yep, it starts, but the request and the process to be approved will happen this fall.
Before then, okay. there was a question about, will the SMI requirements stay 60-40 for the new spaces?
Yes.
Okay. And
did you get to the questions about the group license applicants still need to go through city zoning approval?
nope, but that yeah, that's a good question. That is still we haven't changed that part yet, right? The issues about group family child care and all the local zoning stuff they still deal with.
So group childcare homes are still required to get local approvals, even from zoning. They just don't need to get what's called a special exception. So essentially nothing that applies to a family childcare home can apply to a group, but they still need to go through the zoning permitting process.
Merrill, I'm back. I fixed that.
Yeah. Okay. Great.
Is there someone's asking about the ratios for family daycare? Is there any plan for the future? And maybe you could just go through that process, because I know it's a little bit different.
Sure. These changes to the regulation only apply to childcare centers and group childcare homes. The family childcare home regulations are something completely separate. And so there have not been any changes made to those regulations at this time.
I'm interested in Tracy has a question here that I think I get. She wants to know fire marshal and health department approval if you're using an existing toddler classroom but assigning it to 2-year-olds. Does that make sense to you?
Yes. So anytime that there's a change in use, if you have a room that's currently approved for preschoolers and you want to change it to use it for 2-year-olds, we would require that both the local health department and the fire marshal give approval for using that, like change in use of that space.
Thank you.
And so similarly, if a room is currently only approved for 8 infants and toddlers, if the room has a square footage capacity, to increase the capacity and go to 10 2-year-olds, we would also require that the local health department and fire official gives their approvals.
And so you need to submit a change form if you're using this new ratio?
A change form to the OEC. There's a local approvals form that would be submitted to the OEC as well, that would indicate that both the local health department and the fire marshal have given their approval. They may, each local health department and fire marshal is unique. Some will want to make a visit to the program, where some may be able to do an administrative review and just sign a form without having to make a visit to the program, knowing what the space is.
Okay, I'm going to jump in. I don't know, either Elena or Beth, someone is asking about whether there is any plan in place or what it will take to get a plan in place to reconsider family daycare ratios. Neighboring states are allowed up to 16 in a family daycare. And so someone's just wondering, kind of what's the process consideration?
Well, 16 would fall under our group home regulations, which those regs were just done. However, we are just starting our family child care regs process. So family child care providers will have the opportunity to weigh in on family child care regulations over the next 12 months.
Okay. Can we start sending in the change forms and local approvals, or do we need to wait until the ratio change is final?
I would say we have to wait till the ratio rule is final, which should be in the next few weeks. It doesn't hurt to get yourself ready, but I don't know if local building will approve it until it's actually legal, and it's not legal until it's published in the, but getting all the forms ready and getting yourself ready to roll the minute they come out, I think is wise.
Thank you. Maggie?
There was a question, are we going to receive changes by email in advance about these changes? And we will be sending something out from licensing, I can assure you. But they first have to be changed and made to come into law. So we have to wait until then. Also, Elena and Commissioner Bai, there was a question about my center is not, we're only getting Care for Kids. Are we going to be eligible for these new 900 slots?
Right. So only if you are a current school readiness provider or a child daycare CDC provider are you eligible for these new 900 spaces right now. In the near future, there will be an opportunity through Early Start Connecticut for all providers to apply to become state funded.
Great, thank you. I am guessing that since you don't have this all in writing yet to share with us from the website, that it's still being formed. There's requests here for getting that information out as soon as possible. Also requests for having it in Spanish. I will commit to sending you all the Q&A and the chat immediately after this. Sometimes I wait a day or two, but I'll send it as soon as possible today, so that any of the information, I mean, people are asking great questions and they are telling you exactly what they need. So I think probably this could be very, very useful for you all as you're putting together the information that I assume will go out soon. When should folks plan to get, like, the details you've given verbally today? Do you know when people here will be able to access those in writing?
I believe licensing, we're working on something to send out an update. My guess is by the end of the week. I have to defer to Elena on when the spaces piece will be sent out. I know we were doing a survey of who could take spaces, but in terms of, okay, this is a real application, when can they expect that?
Right, so the application for the state-funded spaces should be within the next few weeks, I would say, where, as you just mentioned, we're currently gathering, right, what the demand or the need is from currently state-funded CDC and school readiness providers. When it comes to Early Start Connecticut, we anticipate that there'll be much more detailed and an RFA that will be released within the next month.
Okay, great.
An RFA meaning a request for application, saying apply if you want spaces for next year, state-funded spaces. And I think this has been, and I can tell from the call, this is particularly of interest to family childcare programs. And we have been very excited about adding family childcare to our state-funded system, and have seen it help our system, help families, and help stability for family childcare providers. So I think, you know, that's just good. And we're hoping that the new Early Start Connecticut will continue that process of really valuing our family childcare providers as partners in this work. The centers have always been in the state-funded program. And also, I think opening up to new centers is a really good thing, and sort of right-sizing, because we, as Elena and I said, we have lapsed many slots, and we don't want to do that. We want the slots. We want the dollars that the legislature assigns to go to families. So we think these are really positive announcements today. More families on Care for Kids, families paying, and what we also find is parents, a lot of providers don't end up charging parents the full fee. So for some programs, part of the 17 million will help fill in the gap of what they're not collecting in parent fees with that capped with us. That's a real positive. Not bumping families off because they get a raise or having parents turn down promotions. This is a good thing. We're really grateful for Governor Lamont's leadership saying, let's go. We need to get more families in childcare. We need to make it more affordable. And the Biden-Harris administration really pushed us hard. Julie Giacone will attest. to get to the 7%, to stop, cutting families off because they get a raise. And then real shout out to the early childhood team for doing the work, and some of the fiscal team. And I see Kristen just hopped on, really trying to figure out how many more could we take so we don't lapse dollars at the end of the year. So I think this is all good news for you and for children and families.
Thank you.
I just had a question about
just real quick, Sandra, I think someone is saying it's a little hard to hear with your mic. I don't know if you can just adjust.
Oh, sorry about that.
No, oh, no, not you, Commissioner. That was for our interpreter.
Oh,
apologies. Okay, Merrill, go ahead.
The current 900 slots that are being redistributed are going to existing programs, but with the new Early Start program, that'll be an opportunity for new providers to apply. And you just talked about wanting to get more family child care providers in. Will they continue to use an intermediary to apply, or would they apply directly?
When the RFP comes out, all those details will be there. We're trying to work it out so there are options.
Okay. I just would
because in the past, a lot of family child care programs couldn't apply because they didn't have an intermediary in their area. So we don't want that to be a reason that programs can't apply.
Okay. So I was just going to say, if you were going to go with the intermediary route, getting some more intermediaries would be important.
Yeah.
Okay.
It's good advice.
Thanks.
Good advice. Okay. Thanks, everybody.
Thank you so much.
Thank you.
Thank you, Elena. Thank you to everyone here from the Office of Childhood. We will pass all of this information on to them. I know there's about 30 unanswered questions here. There's just never any way to get to the volume of questions you all have when the Office of Early Childhood is on, which is wonderful that we are we're listening, we're learning, and we're pushing. This group is pushing the state to do its best for all of you. So all of that information will get passed along. Hopefully you will get what you need from them in writing soon to understand this better. We will post the recording within the next 24 hours. That will include the Spanish language feed, so you can listen to it in Spanish. It will also include, I believe it includes the chat file, which has a lot of information in there as well. We had over 300 people here today, so there's no way to answer everyone's questions, but also what an amazing community we have. So just thank you all for being here today. We have, let's see, Merrill, do you remember what next week's topic is?
Fire prevention.
Fire prevention. Okay.
Would you talk about that for a second?
I will. So next week we have Liz Peretti, who we had today. So thank you, Liz, for volunteering to come back on. And this one's going to be specifically more geared into the emergency regulations that we have for childcare and keeping those kids safe, right? So one of those factors is ensuring that you have an emergency plan. I know that the regs are slightly different as well when it comes to care for kids. They're a little bit stricter with that fire prevention plan and an exit if there's an emergency. So we're going to have a fire marshal talking about the importance of fire extinguishers, being up to date with everything, how often, how do you check it? And then we're going to have Liz and her team coming on, filling in those gaps on the regulation side.
And I just wanted to say that I put the link to the provider survey in the chat again, in case you came on later and missed it earlier. It will take about 10 to 15 minutes to do, so please check if there's somebody else in your program who might also think that they're supposed to do it, to make sure that you're only doing it once. And that survey is hugely helpful to us, so please make sure that someone at your program does it.
Great. All right. Thanks, everyone. As Julie just said, thank you, everyone. Have a wonderful week. It's just exactly what I was going to say. Thank you, everyone. Have a wonderful week, and we will see you back here next Monday.